Welcome to Pharmative Live. I'm Dr. James Partyka, the Pharmative guy. And this is Pharmative Live, and we're streaming live from Palm Springs, California. And I welcome you here to a 10 to 15 minute healthcare forum on various topics. Today's topic is Vax and Relax. Get COVID-19 vaccinated as soon as you are eligible. And we're going to tell you how to do that, why you should do that, and some frequently asked questions which I've recently received about the vaccine. Our sponsor today is the PNN.1 Plus Health mobile app. You can download your app today at your local Apple and Android stores. Not only does it have great music with Pride Nation Radio, PNN.FM, we have a number of other music stations. We have retro TV, retro cartoons, as well as some classic films. But we also have vital healthcare resource tools in the palm of your hand. Vital resource healthcare tools that will improve the health for your family members, your friends, and yourself, such as drugs.com, which has all the information about FDA-approved drugs, side effects, and dosages. And we also have a doctor symptom checker, which allows you to put in your symptoms and get a differential diagnosis of what's wrong with you that you can discuss with your healthcare professionals, as well as a number of others like find the lowest cost drug in your neighborhood, all in the palm of your hand through the PNN.1 Plus Health mobile app. So you see all of those plus signs associated with various apps out there. The plus for PNN.1 means Plus Health, and that's yours free of charge. Download your mobile app today. So today we're going to be talking about getting the COVID-19 vaccine. But before we begin, I want to just make an editorial comment, and that is to the politicians out in the United States that are basically relaxing the mandate on mask usage in the United States. That's the wrong decision. Masks save lives by minimizing the spread of disease, by mitigating the spread of disease in your neighborhood, in your community, and when you travel, that decreases the emergence of mutations of the virus. Mutations of the virus have emerged that are more contagious and more lethal. So COVID-19 not only comes with a number of degrees of morbidity, difficulty in breathing, fatigue, loss of smell, body aches, fever, but it also has long-term complications, cardiovascular disease, lung scarring, brain fog, neurotoxicity, clotting disorders, and a number of unknown risks. Some patients with severe disease of COVID-19 go into multi-organ failure and die. The mortality rate is somewhere, the crude mortality rate in the United States is between 1% to 2%. So we want to wear masks to minimize the spread of disease throughout the community, which will minimize the likelihood of you getting COVID-19, but also others from getting COVID-19, which will minimize morbidity and mortality in the United States. Those politicians that are saying we don't need masks because we're open for business are just saying that because they want you to spend money and your local businesses so that they can tax you on those monies that are fueling the economy. And I would say to those governors and politicians that are minimizing the need for having masks mandated as being totally irresponsible, it's actually governor/politician malpractice not to mandate a mask in yours. Now, the fact that they don't mandate masks means that you can still wear your own mask because you're smarter. This is based on science. Masks are not theater. Masks minimize the spread of disease. In order to have a healthy United States economy, We need healthy essential workers and healthy citizens and customers in order to keep the economy growing. So again, it's absolutely irresponsible for anyone to say you should not wear a mask. Wear a mask. Dr. Fauci tells you to wear a mask, and Dr. Partyka tells you to wear a mask too, minimizing the spread of COVID-19. We're in a pandemic, by the way. We're still in the middle of a pandemic. Wear the mask, decrease the burden of disease in the United States and throughout the world, and decrease the likelihood of more virulent mutations emerging. Wear a mask. All right. OSHA came out with new guidelines, guidance on preparing workplaces for a safe environment for COVID-19. You can go to the Pharmative business page and download those new guidelines by OSHA. Approximately 17% of citizens in the United States are now vaccinated. That's a great milestone achievement. Again, we want to get to the place where at least 75% or more of Americans are vaccinated. Now, the criteria that allows you to be vaccinated is your age, 65 or greater, that you have comorbidities, that you're either an essential worker or you're a healthcare professional. And those are the eligibility criteria right now that allow you to get vaccinated today. Within weeks to come, those eligibility criteria are going to be lessened and more people will be eligible to get vaccinated. And once you do, you want to schedule your first vaccination date. And I'm going to tell you how to do that, because we got to be proactive at doing that. Now remember, in the United States, we have 3 safe and efficacious vaccines. We have the Moderna vaccine, which are 2 shots separated by 4 weeks. We've got the Pfizer-BioNTech vaccine, which is 2 shots separated by 3 weeks. And we have the Johnson & Johnson vaccine, which is just 1 shot. So that's what we have in the United States. All 3 are safe and efficacious. So if you're offered any one of those 3, you definitely want to get that vaccine. There's a 4th vaccine that's available in other areas of the world. It hasn't been approved for national emergency use in the United States. That's the AstraZeneca vaccine. This past week, it's been in the news that the vaccine is associated with clotting disorders and bleeding that is being evaluated. It's a very small group of people. It hasn't been fully established that there's an association between the vaccine and these clotting disorders or bleeds. However, they're being monitored very closely. Again, the AstraZeneca vaccine is not available in the United States, but it is available in the world. I also want to assure and recognize the people that we have out there, Helen and Jimmy and Alan. Give you a shout out and thank you for joining us on Pharmative Live. We have a very extensive safety monitoring program in the United States that monitors the safety of all vaccines, so that the CDC is monitoring again if there's the emergence of any kind of safety signals. The good news is that the vaccine, millions of people throughout the world, including the United States, have received one of these 3 vaccines, the Moderna, Pfizer, J&J, and it's extremely safe. It does not cause COVID-19. It does not cause autism. And only 11 in 1 million people may have a severe allergic reaction. So if you have a history of severe allergic reactions to, especially to IV medications, you want to discuss that with your pharmacist or clinician who's administering the vaccine to you at the time you get the vaccine shot, so that they're prepared and they can monitor you for 15 to 30 minutes after the vaccine shot for any kind of allergic reaction. And they can manage that with appropriate supportive care measures if needed. But again, only 11 in 1 million people have developed severe allergic reactions. So that means the drug is safe and efficacious, and we know the Moderna and the Pfizer vaccine have 95% efficacious rate, and we know that all three vaccines prevent moderate to severe COVID-19 disease, prevent hospitalizations, and prevent mortality. So the efficacy, the benefit far outweigh the risk of any side effects associated with the vaccine. So benefit far outweighs the risk, and the cost is free to you. So get vaccinated. There's no reason not to. The science dictates that the drug is safe and efficacious. You do not want to take the chance of getting COVID-19 disease, as it is life-threatening and there's significant morbidity associated with it. And people who come from poor backgrounds, or who are Black or brown people, or who have high comorbidities are more at risk to developing moderate to severe COVID-19 disease. Hi, Jay Friendly, who's out there watching as well. So again, get vaccinated. The benefit far outweighs the risk. The risks are minimal. 11 out of 1 million patients develop severe allergic reactions, and that can be well managed. Now, there are new CDC guidelines, and again, you can go to the Pharmative business page on Facebook to get these guidelines from the CDC, which allow grandparents who are vaccinated to visit with their grandkids who are not vaccinated, because we do not have a pediatric approval for vaccination at this time, although those studies are underway. So that's good. Also, for those people that are fully vaccinated, and again, after the last shot, it takes 2 weeks for your immune system to be fully immunized against the COVID-19. It's acceptable for small gatherings of adults who have been vaccinated and are fully immunized. Once you're vaccinated, fully vaccinated, take a picture, take a photo of your vaccination card and put your vaccination card in a safe place. Because in the future, I'm expecting that there will be travel requirements proving that you're COVID-19 vaccinated. And so you definitely want to keep that vaccination card in a safe place. Take a photo of it. And as we've discussed in previous Pharmative Live forums, it's always helpful to have a healthcare journal located in your notepad. In your notepad, you're going to put your name, your contact information, whether you have drug allergies, a list of your current medications, a list of your current medical history, and you can actually directly in your notepad take a picture of your vaccination card, take a picture of your driver's license, take a picture of any kind of laboratory reports that you may have that are relevant to your medical history, and carry that around and let people know that you have a healthcare journal on your phone, on your notepad. Very helpful to have the actual dates that you received your vaccine, especially if in the future booster vaccines may be a requirement based upon the emergence of these mutation strains of the virus. So again, we're going to have to be proactive. There's another website that you can go to on NBC News, Plan Your Vaccine. And this is a nice, easy website tool, and it's available in multiple languages. The link is posted on the Pharmative Facebook page as well. And based upon your location, your age, and your occupation, it'll determine where you can get your vaccine and where you can schedule your vaccine. I have friends that just went to CVS.com, scheduled their first appointment, and scheduled their second appointment at the same time. And it was a very orderly process, but there are many pharmacies throughout the United States. There are large vaccination sites located in the United States. You can also get that information from your local news and your local public health state official websites. And again, you have to be proactive. You have to go out when you're eligible and make your appointments. We're also going to be proactive that even if we're vaccinated, we're still going to wear our masks, because we're not sure if you can carry the virus as an asymptomatic carrier. Again, we're going to all wear masks to prevent the spread of disease. to decrease the likelihood of mutations. And we're not going to listen to politicians who tell us not to. We're going to wear it because it's the right thing to do. And science tells us this isn't theater. Science tells us this decreases the spread of a contagious pandemic virus called COVID-19. All right, now, so we're going to be proactive. We're going to be proactive when our turn is up to get scheduled a vaccination appointment. There are many tools on the Pharmative webpage that will point you in the right direction to locate where the nearest site is to you. You're going to assess whether you meet those eligibility criteria. Again, they're going to be changing soon, so you want to watch for that. You want to schedule your vaccine appointment. Hopefully, you can schedule both appointments at the same time. You're going to help your neighbors, families, friends, your community, your church members, and help them with ride sharing to get them to the vaccination sites, because not everybody has a car. So we're going to do that. There are ride share programs. One I know for sure with Lyft that will give free rides to get you to a vaccination site. Okay? Once you're vaccinated, now you're going to take the first day a little bit easier, and certainly after the second shot, take it easier, because associated with the shot is soreness, fever, body aches, and fatigue. And that's actually a good sign. It's a good sign in the sense that the vaccine is working. The vaccine is stimulating your immune system to produce antibodies against the spike protein that's located on the external part of the virus. And that's what we want. We want your own antibodies made against the virus. So once that virus tries to invade you, bam! You're already armed and ready with antibodies to stop the spread of disease within your own tissues and organs. Okay, so those side effects associated with the first shot or the second shot, more commonly on the second shot, can be managed by just taking some time, rest, keep yourself hydrated, and take generic Tylenol is recommended. Again, that'll help with the fever, the body aches, and you'll probably have soreness at the injection site. Okay. Now, those people that have already had COVID-19 should still get vaccinated because of the emergence of mutation strains. All right? You should still get vaccinated, and those people have more side effects on the first shot. Like the people that never had COVID-19 have more side effects on the second shot. They have more side effects on the first shot because they've already been exposed to COVID-19. So again, you're going to have a more robust immune system, which is associated with those side effects I just listed for you. Once you're vaccinated, you're going to continue to wear your mask, practice social distancing, avoid large crowds when possible, and certainly continue to wash your hands and use hand sanitizers. All the things that we were told before, we're going to continue to do because we're in the middle of a pandemic and we want to stop and crush the COVID-19 from spreading throughout our communities. That's all I have for today. I'm Dr. James Partyka, also known as the Pharmative Guy, and I will see you next time. And in the meantime, stay healthy, as it's easier to prevent disease than to treat disease.